What is PCOS? How do women with PCOS get pregnant? So this is one question that I'm gotten a lot. Is it only through IVF? Can women with PCOS conceive naturally? Now, let's start with what PCOS truly is. PCOS stands for polycystic ovarian syndrome. What does that mean? That means that your ovary is constantly producing too many follicles, immature follicles. Follicles is a sac filled with fluid. That is why we call it cyst, meaning that your follicle does not mature eggs and release eggs for ovulation. That means that you don't ovulate. To be able to diagnose PCOS, you need to have irregular menstrual cycle. You need to have multiple cysts in your ovary, up to 20 cysts in your ovary. And you need to have high androgen level. Yes, hyperandrogenism. You might have these three of them or two out of these three symptoms. So that is when you can properly be diagnosed by a medical practitioner that you have PCOS. And sometimes this PCOS diagnosis can be very, very challenging. It can be confusing. You see someone with very regular menstrual cycle, but with very high androgen level, very, very high androgen level, and multiple cysts. So many people have different symptoms. The symptoms for Mrs. A and the symptoms for Mrs. B can differ. Now, let's get into this video properly. How do women with PCOS get pregnant? Women with PCOS can get pregnant through one, lifestyle management. Yes, you need to be able to manage your lifestyle. One, sleep properly. Sleep at least 7 to 8 hours in a day. It is very, very important because lack of sleep deals with your hormones. And reduce stress, manage stress. It has a long way to go with regulating your hormones. Another thing is to maintain your weight, maintain healthy weight. Yes. Try to calculate your BMI, body mass index. It is very, very important. At least exercise at least 30 minutes a day. Not strenuous exercise. Simple exercise. You can walk. You can skip at the comfort of your home. It will go a long way in controlling your hormone. The last but not the least is eat balanced diet. See, a lot of you are guilty. Reduce processed food. Reduce trans fats. Eat a lot of protein. Eat carbohydrate in moderation. Some people will tell you cut out carbohydrate, but I'm not going to tell you to cut out carbohydrates. Eat carbohydrates in moderation. Eat dark leafy green vegetables and reduce added sugar. Okay, this will go a long way in managing your hormone. Remember that PCOS is a hormone thing. Okay, if you have insulin resistance, you have no business with eating anyhow. Yes, lifestyle management is going to go a long way in controlling your insulin resistance. So lifestyle management is one major way of trying to manage your hormone, and with that you can conceive naturally. Another way to conceive is by trying to regulate your ovulation. Yes, this to regulate your ovulation. You can do that by using some medications which will be prescribed to you by your doctor. Yes, these are prescription drugs. You'll be prescribed by your doctor. The doctor is going to monitor you as you take this medication. Medications like letrozole and clomiphene, they are going to help you to ovulate and mature eggs so that you can ovulate. That's one way you can get pregnant with PCOS. Another way is by managing insulin resistance. Like I said earlier, lifestyle modification is going to help you. If you are someone on a bigger size, by using lifestyle modification, trying to manage your diet, exercise, sleep very well, reduce stress, and all that is going to help to reduce your insulin resistance. And sometimes your healthcare practitioner is going to introduce some medications like metformin. Metformin is going to help you to manage your insulin resistance. And mind you, this is not over-the-counter drugs. This is a drug that will be prescribed by your doctor. And as you're taking it, your doctor is going to monitor you and make sure that this drug works for you perfectly. Another way you can get pregnant with PCOS is by tracking your ovulation. You can use ovulation kits or you can monitor your cycle. I have a video that I made on how to calculate your ovulation, how to calculate your cycle length. You can watch that video. It's going to help you to know how to calculate your cycle length and your ovulation. This is going to help you to know your fertile days, your fertile windows, so that you will know the right time to meet with your partner. The last but not the least is by reducing your androgen level. Yes, androgen level can hinder your pregnancy. It can stop you from getting pregnant. You can reduce your androgen level by using diet. Lifestyle modification is going to go a long way in reducing your androgen level. I hope you learned a lot from this video. Don't forget to share this video and don't forget to subscribe to our channel. We'll see you on our next video. Bye bye.